Well, hello everyone. My name is Dominic. I lead the advanced planning for our team here at Bear. Today I have a special, quite famous guest amongst our clients, Lyndia with Move Health. If you could please give yourself a little introduction.
Yeah, hi, I am Lyndia. I am with Move Health. I am a licensed health insurance and Medicare specialist. This is actually my eighth year in health insurance and Medicare.
Oh, thank you. I mean, you are quite a resource to our clients, and that's why we wanted to get together today. Because we have so many people that run into situations where they need to figure out healthcare before Medicare. This pre 65 space is quite confusing. And so I thought I would let you speak a little bit more about that today. Also, some of the Medicare, space there, and then a few different scenarios as we walk through. So if you could to start to explain the process in which you work with clients.
Yeah, absolutely. So we actually partner with Baird. We partner with your advisor directly. So in this case, Dominic or the Headley Hager Group. The way that they work is that they'll send you over to me, and we will work with them one-on-one on how to keep income low, so that we can really maximize on some different things that we'll talk about today. And then they are able to more accurately plan for your future and your retirement because we will always keep them in the loop on what plans we choose, what deductibles we have, what the cost is. So our first appointment that we will have with you is going to be the discovery meeting, just like you have with Baird, where we just figure out what's your timeline, what's your situation, what are you needing help with, whether it's pre-65 or Medicare. And then we'll sit down with you, educate you on all of your options. We'll go over some of those today, but we'll go really deep with you whenever we talk to you one-on-one. We always have to say these conversations are meant to be as a blanket or a very high level conversation. But when we speak with clients one on one, we go more in depth in each person's personal situation.
Well, perfect. Would you mind sharing your screen and starting to walk through some of those slides that you've prepared?
Absolutely. Get you pulled up here. All right. So this is just a little bit about me. I do have three teenagers, which is one of the most time-consuming parts of my life. So outside of doing health insurance and Medicare, I'm typically found driving them around. I also do community theater, so that's a really fun way for me to kind of get some of my energy out when I'm not helping people with health insurance and Medicare. All of this information can be found on my bio page at movehealth.io/Lyndia. So if you're curious to learn more about me, you can always learn more about me there. It just, this is exactly how Dominic kind of started. I'm
Mhm.
financially ready to retire, but I don't know what to do for health insurance before I turn 65. I hear this every single day. For the majority, I hear people say, well, I'm just going to wait until I'm 64 and a half, and then I'll take Cobra for 18 months, and then I'll just go on Medicare, or I'll just work till I'm 65. But there are options out there now where you don't have to work till 65 if you do not want to. This is kind of a little study that was recently done that talks about how healthcare is a top concern for retirees. 62% of Americans are terrified of what healthcare costs may do to their retirement plans. It's regularly listed as a top three concern for those nearing retirement. We know this. Insurance is difficult. It is incredibly hard. Even me, who's been doing it for 8 years, sometimes I look at things and I'm like, this doesn't make any sense. Why is it done this way? I, on a daily basis, say to myself, I do not know how people do this on their own. I do not know how people do this without having some expert in this field. 72% of people now expect healthcare planning as part of their retirement plan, which is why Baird is so amazing because they already know that. They're ahead of the curve on knowing my clients need healthcare planning as a part of their entire wealth plan. So we can kind of go over high level some of the options that are available to people when they retire before 65. One of those options is retiree benefits. These are not available to everyone. It's actually pretty rare that people have retiree benefits that are available to them. It usually means that you've been with a company for 10, 20, or 30 years. And so they're offering some type of plan or some type of healthcare reimbursement for you to be able to get health coverage outside of an active employer. So this is one option that we can look in, and it's one of the things that we take into consideration here at Move when we're looking at all of your options is, are you offered retiree benefits? What are their costs? What are their deductibles? What are their out-of-pocket maximums? Some of the cons on those is they are getting skinnier. Those plans are starting to have much larger deductibles, much larger out of pockets. They're mostly switching over to HMOs, so you don't have as wide of a network as you're used to. And they can be really costly. Even if you've worked for a company for 20 years, those plans tend to be pretty costly. Another option that we take into consideration when looking at under 65 is COBRA. So, COBRA is just a law that states that your employer has to give you 18 months of continuous coverage after you separate from the company. In order to have COBRA available to you, you have to have an employer that has at least 20 employees that are available. So that law is only for people who have more than 20 employees. It's important as a side note to know that if you are over 65, you cannot use COBRA once you are retired. You have to go Medicare because COBRA is not considered creditable coverage. We really only recommend COBRA to those who have already met their deductible for the year because COBRA is just a continuation of the plan that you already have with your employer. If the cost is low, we'll go COBRA, but for the most part, COBRA is really expensive. When you calculate COBRA costs, you're usually looking at what you've paid towards your insurance, what your employer pays towards your insurance, plus a 2% fee. So COBRA can be really expensive compared to some of the other options that are available. So it's very rare that we will say COBRA is the way to go, but it does absolutely happen. So this is another thing that we will take into consideration when we're looking at all of your options available in the individual market. Anything to add so far, Dominic?
No, you're covering it great. That's why I let you do the work here. Appreciate it.
Good stuff. Good stuff. So another option that we can look into is what's known as short-term major medical. The short-term part of that is what's going to really stick out here. One of the cons that we'll just go ahead and jump right into is short-term is as of September 1st, the federal government has regulated these terms to 90 days. So you can only hold short-term major medical plans for 90 days at a time now. You can write multiple policies that are 90 days long, but you have to go back and forth between carriers. So really these plans are reserved for those who just need short-term coverage. If you are in between jobs and you need something before your new health insurance starts, if you're moving and you need to just kind of fill a gap, this is where we go with short-term. Short-term is only available to those who are relatively healthy because they do require medical underwriting. So major medical plans are going to ask you 20 or so health questions. They're going to pull your prescription history. They're going to deny you if you've got anything major going on, and they're surely not going to cover anything related to a pre-existing condition. So these are very rarely used as well, just in those short-term interim spaces. The increasingly popular option that's actually happening now is the healthcare sharing plans. A lot of these and the ones that we work with, so I can only speak on the ones I work with directly, but the one I work with directly, you have to be a Christian to join. You have to be a non-tobacco user. Those are your only two qualifications to join the healthcare sharing programs. However, this option doesn't share in the cost of pre-existing health conditions. So if you've got something major going on, it may not be a good option, but they do use very large networks. So these are good for people who plan to travel a lot in retirement. And they are very cost effective compared to the Affordable Care Act for very high income earners. So if you're retiring at the end of the year, you've got a lot of W-2 income for the year, maybe you don't qualify for our next option. This could be a really good filler for that. It's also a really good option to keep all the way up till Medicare because one of the great things about the healthcare sharing options is once you enroll, you're in it till you cancel. So this is one of those set it and forget it. So once you're retired, you don't want to worry about healthcare anymore. Healthcare sharing could be a really good option for you. The star of our show today is going to be the Affordable Care Act. So a lot of people don't realize that the Affordable Care Act is an option now in the individual market, and they are guaranteed issue. So this means that no matter what your health is like, no matter what your pre-existing conditions are like, they have to give you these plans. The cost of these plans are only based on your age, where you live, and whether you're a tobacco user or not. Those are the only three things that they can base those costs on. However, we now have these extended subsidies, which I'll touch on in my next slide, which can help make these plans really affordable for people in retirement. Some of the cons of the Affordable Care Act are that they tend to have restrictive networks. So we're looking at EPOs, HMOs, and HMOs POS. What these mean is that you have to stay in network. So if you are speaking with a broker and you're trying to choose an Affordable Care Act plan, be sure that you are giving them all the doctors that you have, all of your medications, because you will not get any out of network benefits with these plans. And then you've got just a little bit of extra legwork at tax time because there is a nice, fun little form that you have to file with your taxes if you are a member of the Affordable Care Act plans. let me kind of move to this next slide here. This is the big one, is that they are guaranteed issue now. So what I've learned a lot in my career is that people think there's no option for them if they have any kind of pre-existing, even if it's something, as simple as type 2 diabetes or high blood pressure or high cholesterol. In previous years, there weren't really a lot of options for people in the individual market that had pre-existing, because you would either be denied or they would rate you up to high heaven. Something similar to like if you had your property and casualty. If you had wrecks in the past, your property and casualty insurance would be more expensive, or they just wouldn't cover you at all. That's kind of how health insurance used to be before the Affordable Care Act went into place in 2010. Now you cannot be denied due to health conditions. You cannot be rated up based on what your health is like. And so it's really made a huge difference for those people in that early retiree space to feel like they don't have to only accept COBRA, or that they don't have to work until they're 65. We also have something really cool now that is offered to us in these extended tax credits. In previous years, there was a cap on how much income you could make to qualify for these tax credits. We used to call it the income cliff, because if you made $1 extra over that amount, you didn't get any tax credits at all. And it was a very big difference between, let's say, 49,000 for a couple of two getting $150 a month in tax credits to a $50,000 income getting none. And so you would just drop off and you wouldn't qualify. This was actually removed as a part of the American Rescue Act that went into place in 2021. So instead of there being a cap on how much you could make to qualify for tax credits, now the federal government looks at the second least expensive silver plan that's available in your zip code. That plan cannot cost you more than 8.5% of your modified adjusted gross income for the current year that you are in. If it does, they adjust the cost of that plan down, and the difference is what they issue to you in a tax credit or a subsidy that you can put towards any plan you choose on the marketplace. And so now in some places, we are seeing couples making $250,000 or $300,000 a year that are still eligible for some sort of financial assistance with their plan. This is really where we come in as a partnership with Baird, is because we can say, hey, Dominic, how low can we make that modified adjusted gross income for them this year? Can we pull from accounts that are not taxable so that we can keep their health insurance costs low until they get to Medicare age? And that really helps us work fluently together, so that we can come up with the best strategy for you long term.
Sometimes, when people start to get 2, 3, even 4 years until 65, it does tend to make it a little bit, always control what we can, but the longer the time frame, it tends to get just a little bit harder. Full disclosure there.
It absolutely does. And that's why it takes that constant back and forth communication of what are your future plans? Are you wanting to take a cruise next year? Are we wanting to do Roth conversions? And so just putting that whole plan together until 65. Just a quick case study here. So this is just a 60-year-old couple that is in Columbus, Ohio, ready to retire. And retire, their income is going to be $85,000. So in previous years, they would not have qualified for any tax credit or subsidy at all. And this is an actual case study where this client went to their financial advisor and said, I'm ready to retire. That financial advisor spun the computer around and said, okay, your average cost for healthcare in retirement is going to be $22,000. And he looked at his advisor and said, well, I don't hate my job that much. I'm going back to work. Luckily, he knew us and we were able to talk to them, because now with these extended tax credits, their average cost of coverage with an $85,000 income is going to be closer to $7,000 a year. So it's the same exact plan, but they're now eligible for those subsidies where they were not in previous years. So he did retire. This is him with his grandson up here, true story, that very next year. And so we've got more options now than ever before. Anything before I kind of move into these frequently asked questions, Dominic? Anything I missed?
Yeah, I know we always try our best at estimating income for the year. If something happens, if our estimates are off, and income is higher than we expected during the year, what happens? Should we do anything? What happens to those taxes, those credits?
There's a couple of different ways that we can handle these situations. You can call in and you can update your income at any time during the year. And what happens is, let's say you update income with me in May, it's going to adjust your premium for that following month in June. So you're going to have a higher premium in June. Then when you file your taxes, you're going to get that 1095A form that you file with your tax return. and it's going to have you make up the difference or reconcile the tax credits for the months that you had the lower premium and should have been paying the higher premium. So we
Mm.
can either do that at tax time, or one of the strategies I use is calculating what that would have been. And when we update income, not take all the tax credits and try to level it out to where at tax time you don't owe anything, but some people like to just pay it back at tax time. So that's always an option as well. And it works both ways. So if we shoot really high on income and you file taxes and it's lower than that, then you're going to get those advanced premium tax credits back whenever you file. You're going to get those as a refund. Good question. So that one's here. What do we do if my income varies from year to year? We also renew these plans with you every year. So if this year you worked and you're retiring in October, and so you're going to have a very high income and your income is going to show a little bit higher than it will next year, when we will reconvene in November of every year and say, all right, what's our plans for next year? And then we're going to try to estimate as closely as we possibly can, because no one really knows what their income is going to be in those following years. So every November, we're going to try and anticipate the income for the following year, and we're going to re-enroll and renew your coverage based off of that income. And then if it changes throughout the year, we can always update it. You cannot change your plan throughout the year, but you can change the income level that we put in. And I'm going to I'll pop back up here to one, because I know that this one happens quite often for you, Dominic, is this question is, what do I do if I'm 65 or over 65 and Medicare eligible, but my spouse is younger than me? This is something I work with every single day. I'm also a Medicare specialist. So Medicare is very individualized, incredibly so. And so Medicare on a 65 and plus is going to be their own individual plans, their own individual policies. But then we can also put that spouse that's under 65 on the Affordable Care Act by themselves, or in a faith-based option by themselves, or even look at COBRA as an option on their own and just split them up. And then when that spouse turns 65, we'll have that Medicare 101 with them and then put them in their own individual Medicare policies.
Perfect. That's so helpful because we get that question, so often with the different ages, with the different timings, and it's been really awesome having you help at the same time kind of coordinate efforts.
We definitely see that a lot, where people will work way past 65 until their spouse is 65. I'm like, we don't have to do that. It's your time to retire. You have put in your work. Let's see what we can do to figure out other options for you outside of that. And that
Yeah.
kind of rolls into the second one here as well, is what do I do if I enroll in health coverage with you, let's say through the Affordable Care Act, and then I turn 65? We're going to help you with that transition over to Medicare. Because like I said, Medicare is very individualized. And once you are Medicare eligible in the individual market, you have to take Medicare. There are no other options outside of Medicare once you're 65. So we'll help you with that transition as well. And if that means canceling your ACA or Affordable Care Act plan when you go, or just putting your spouse only, we'll help with that process.
Mhm.
And my favorite is, when should I start talking to somebody about my options? This varies. We don't get the new plan options for the following year until November. So if hey, I'm not going to retire until next year, sometimes waiting until November is best. We're always happy to do an introductory call about 6 months before when you're planning to retire. And I say that because sometimes I talk to people in that 6 month period of time that says, I'm not retiring until maybe next year or the year after. And we talk about healthcare costs, and they move their retirement date up. And they say, well, I had no idea that healthcare could be this affordable. I'm not waiting until next year to retire. I'm going to retire in 6 weeks. So we're more than welcome to have this conversation with you at any time. The best and most accurate quotes are going to happen about 90 days before. So we'll always do a follow-up call as we get actually closer to that retirement to nail those numbers down. But we can have an introductory call at any time. Yeah. And I think we kind of touched on this, the relationship between Move Health and Baird. We partner with Baird. We are an official partner with Baird. And the way that we work is just keeping your advisor in the loop. Your advisor is going to send you over to us and say, this is their situation. They're looking to retire in a year. They're looking to retire in 6 months, whatever it may be. We're going to go back to Dominic and say, these are the plans that we can see available to them based on this income. Is there anywhere that we can kind of move these incomes around, or do we just need to go ahead and plan for this is what their costs are going to be going forward, so that they can actually work that into your plan, and your plan is more holistic and it is more spot on than what it can be sometimes with the planning software through Baird, because they're very conservative through that planning software. So we have learned. And I always get this one as well. How does Move Health receive compensation? It does not cost you or Baird anything at all to work with us. The cost for these plans are all worked in. We have a commission that's worked into those costs of those plans. Whether you work with an advisor or not, the commission is in the cost of the plans already. I am a salaried employee. And so I get paid the exact same amount no matter what advice I give you. This helps us with that fiduciary responsibility to you to make sure that we are giving you the best advice for your situation, whether that means going with Cobra, going with a retirement plan, going with an option that I'm not necessarily contracted with through the Affordable Care Act marketplace, or going with something that we can service and enroll you in. We will get paid upon placement of a plan that we are contracted with. And the last one, how can you schedule a meeting with me? Contact your financial advisor with Baird. Contact Dominic directly. He will have all of my contact information and he will put you on an email with me to introduce you to me so we can get you scheduled.
Perfect.
Anything to add?
Perfect. No, I mean, we just truly appreciate your partnership helping clients walk through because it is such a this open environment that we can customize to an extent, for the clients based on whatever their situations are to try to get a good, situation for them, an outcome. So if we could, maybe it's a natural, move into just general Medicare questions because that's one of my favorite parts about you is that you can help us get to Medicare. So if we could just walk through some very basics on Medicare, nothing too crazy, but just really from high level, some Medicare information.
Yeah, absolutely. So I think probably one of the questions I get the most often is what do I do if I am working past 65? Do I have to enroll in Medicare? I get told if I don't enroll in Medicare, I'm going to get penalized. And there's kind of that fear factor there. If you are working past 65, you do not have to enroll in Medicare yet. As long as your employer has more than 20 employees, the coverage that you have through an active employer is considered credible for Medicare. So you do not have to enroll. If you're taking Social Security currently, or maybe your spouse is, they will have to actively let Social Security office know that they don't want Medicare yet. It's like, hey, we're deferring it. We don't want Medicare. If you are not actively taking Social Security, they're not going to enroll you. And so you don't have to do anything until you go to retire. It's a little more legwork when you go to retire because there's a document that you have to have called an employment verification letter that has to be filled out and has to be sent in when you apply for Medicare Part A, B if you've worked past 65, but it's still a pretty simple process. So you don't have to take Medicare yet. That's usually the route that we recommend because Medicare has a cost and there's no use in paying the cost of Medicare plus paying the cost of your employer's plan. This varies with the spouse. So if you have a spouse that's on your employer plan and they don't have any coverage offered through their job, I still recommend scheduling a Medicare 101 for the spouse because in a lot of instances, traditional Medicare is going to be less expensive and more comprehensive than a spouse being on your plan with you at work because that's where insurance gets really expensive through employer plans is when you're adding your family and you're adding your spouse. And so we always say take a look, see what it would be to move your spouse onto traditional Medicare, but there's a lot of kind of ins and outs with that. Like if you're contributing to an HSA for the both of you, then you won't want to take Medicare yet because as soon as you are eligible for Medicare Part A, you're no longer able to contribute to an HSA. So there's a lot of moving parts when it comes to that. But for the most part, you can defer Medicare if you are actively working. So that's a big one that I get. I also get the question of, what do I do for the gaps in Medicare? Is the Medicare supplement better? Is the Medicare Advantage plan better? This is all going to come down to your personal situation and your personal preference. We very much love the Medicare supplement. We are a Medicare supplement heavy place, and there's a lot of reasons for that. The big one just being freedom, having the freedom to choose your doctors, having low out of pocket risk. Supplement for us is the preferred route, but in a lot of cases, the Advantage plan is what works the best for a individual. So that's why it's really good to talk to somebody who knows both of those things, the supplement and the Advantage, and can complete a Medicare 101 and go over the differences between those two types of plans because they are incredibly different.
And with those, which one from my memory, you can get into one of them, but you can't get out. What is that in and out function between those two?
That is a great question. One of the things that I try to make sure that every person I talk to is aware of is that there is a time period whenever you start Medicare Part B for the very first time called the Medicare Supplement Open Enrollment Period. This period starts 6 months before Medicare Part B starts, the month of, and 6 months after. During this time period is the only time that you can get a Medicare supplement without any health questions. Guaranteed issue. You could be in active chemotherapy and they have to issue that supplement to you. When that 6 month period of time passes, that is no longer the case. And so sometimes people will start with a Medicare Advantage plan because they're low cost and they're healthy. And then a year or two down the road, they're diagnosed with something critical like cancer, heart attack, or stroke. At that point, a person cannot go to the supplement. And so the best move is to start with a supplement, and then later on down the road, you can try an Advantage plan. But if you start with a supplement, you know that you're going to have guaranteed coverage throughout your lifetime. If you start with the Advantage plan, there's no guarantee that you could ever go back to a supplement.
Yeah.
That's a big one. And not a lot of people are told that. I hear that a lot where I'm talking to someone about their Advantage plan and they say, well, no one ever told me that this is the only time I can get that supplement. And now I've got really extreme health concerns and I want to go to places like Mayo Clinic or Cancer Treatment Centers of America or MD Anderson. And those places don't take Advantage plans. They only take traditional Medicare with a supplement. And at that point, it's too late to go back. So it's always something to consider when you're making that transition to Medicare.
Mm. So it seems like, we've been in this scenario where we've had clients that have coverage or help through, companies such as AEP. You've been able to help them work through their options with Medicare. Can you just talk a little bit about that, how that works?
Yep. So the annual election period for Medicare is actually coming up. It does begin on October 15th. We get plan previews starting October 1st. And so during this time period that starts October 15th and it goes through December 7th, this is the only time during the year that you can make changes to a Medicare Advantage plan or a Medicare prescription drug plan, also known as Part D for drugs. This year, it is very important to review these things because there are some significant changes coming next year with prescription drug coverage. And so, even if you are completely happy with your prescription plan or your Medicare Advantage plan, it is the time to review it because we have great things happening next year. I have to say it as such as hearsay because there hasn't been an official ruling yet, but hearsay is that they are getting rid of the donut hole in prescription coverage on both Advantage plans and standalone Part D. And so anyone who has ever been a victim to the gap phase or the donut hole, you will not be starting next year, which is really great. And then they're also going to be putting a $2,000 annual maximum limit on how much any Medicare beneficiary will spend on prescription drugs for the year, which is new. This year was the first year that we had a limit and it was closer to 4,000. So next year it's going to be 2,000. They're also starting something called the Medicare payment plan. And so anyone who's currently on Medicare may know that all prescription plans have some sort of deductible that you have to hit on name brand medications in January of every year. It tends to be about $545 that you have to spend that first month of the year. Medicare is going to be starting something next year where they will pay that deductible for a beneficiary if they qualify and then spread it out over 12 equal payments throughout the year so that in January, people are not going and having to pay $600 for their first fill of medications for the year. So this is going to be incredibly beneficial for Medicare beneficiaries as well.
There's
Lots of good stuff.
a lot to it. One of the things is that we can still help manage income because their IRMA adjustments are a lot higher than the pre-65, but we're here to help you kind of walk through that. And could you just talk a little bit about this form that tends to pop up for people that are just retiring when their income is different when they're working versus being retired, the SSA 44 form? Just what is it from a very high level, and what is the benefits of it?
So this, in layman's terms, is your appeal form for IRMA. And what IRMA is your income-related monthly adjusted amount. We call it IRMA for short because that is a mouthful. We also call it the You Did Well for Yourself tax.
Yeah.
The way that works is that it looks at what your income is 2 years prior. So if you are planning on retiring next year in 2025, you're going to make that transition over to Medicare. They're going to be looking at what your income was in 2023. If that income is over a certain threshold, you've got higher premiums issued for not only your traditional Medicare, but there's also higher premiums on your prescription drug coverage, no matter what option you take. There is a way that we can combat this, and it's by filing that form, the appeal form. If you can show an actual drastic change in your income, there isn't a way to appeal that IRMA. It's an arduous process. It isn't easy, but it is worth it because the worst they can tell you is no. And so if you really are going to see a really huge change in that 2 years worth of income, then an appeal form is something that should absolutely be filed.
Well, I appreciate it. This is a lot of good information. Definitely can't just take it for what it is. Need to actually contact you to go through it for what makes best, for their situations. You have any closing comments, for today?
Just adding on to that is everybody's situation is different. Everybody's situation is unique. What works for one person may not work for another. And so it's incredibly important to speak with someone who is versed in this field, who is educated, someone who is willing to give you all of your options and all of your information. So if that's not me, definitely find someone you trust. I always tell people shop around. Don't always just go with the first person you talk to. Make sure that you're doing your research. And if you ever have questions about anything, you're always more than welcome to reach out to me or Dominic directly.
Perfect. Thank you so much for your time today. If this interests
Oops.
you, please reach out to me and I would love to connect you. All
Absolutely.
right.
Thanks for having me.
Thank you.